what I was finding in my practice was a fairly significant incidence of exacerbated dry eye symptomatology for at least 2 and often 4 to 6 weeks, sometimes extending into 8 weeks, where they required continuous eye lubrication and drops due to the fact that the eyelids were swollen. Um, One of my fellows, Dr. Jess Prishman, and myself, we did an interview study and also research study to determine what is the general incidence of dry eye syndrome in our population of patients prior to blepharoplasty, and that was about 26%, some symptomatology, various degrees. And then we looked at when I do upper and lower blepharoplasty or just lower blepharoplasty, um, and we looked at incidences of exacerbated dry eyes. And when I do a lower lid blepharoplasty, about 97% of the time I do it through a transcutaneous approach, skin muscle flap with a suture suspension. I'm doing other things, what we call fat transposition. So we looked at all the factors involved, and we saw an incidence that was up to as high as 35, 36% after blepharoplasty. So more than just the average population incidence. It was definitely causing dry symptoms and symptomatology, needing gel at night, eye drops during the day, even to the point of chemosis developing. Chemosis is the conjunctival edema or swelling that can be mild to very dramatic, pushing actually the lower lid out, sometimes a temporary look of ectropion, which of course then feeds the cycle, exacerbates the problem of the tear film not covering the cornea, and they even get worse. Then we'd use steroid drops, and we would even treat it with taping the eyelid up, trying to cover over the chemosis or conjunctival bleb. And it's a very significant management problem for, again, 30 to 35% of your patients. It doesn't happen all the time, but it happens frequently enough that you need to know how to deal with it. And we came up not only with what were the reasons why and what was the incidence, but all the way to treating it with a surgical conjunctivotomy, which means open the sac and let the fluid drain out of that conjunctival bleb, which speeds up the resolution of the problem. When you have thick, swollen lower lid, it may not get back to normal for 2 to 3 months. Usually in 6 weeks, it's cleared up, but I've seen cases extend beyond that. So I think it's a very helpful thing to realize that it does happen. It's going to happen to you if you do a lot of blepharoplasty, and particularly lower lid. And it's not exclusive to skin muscle flap. I mean, it does happen in transconjunctival. The incidence drops down to about 21% in transconjunctival approach, but it's there. And people don't realize that all the patients who have LASIK surgery or have had LASIK surgery prior to having this procedure, now they're looking at their eyes aren't covered with their glasses, and they want this cosmetic improvement. They're at a higher risk of this or higher incidence of this because they even themselves have dry eye symptoms or long-term dry eye syndrome after LASIK surgery.